Well, good morning, everyone. Those of you online and those of you with us here this morning. I have Minister Jameson and Dr. Morrison here. Dr. Morrison will start off our news conference with our most recent up-to-date COVID story. And Minister Jameson and I will be here to answer any questions you might have. And Natalie, do you have a statement or just you're going to answer questions too? Sure. All right. So over to you, Dr. Morrison.
Okay. Good morning. Actually, it might be almost afternoon. I'm sorry. Today, there's one new case of COVID-19 to report in PEI. This individual traveled outside Atlantic Canada and is a close contact of a previously reported case. Contact tracing is complete, and the person is self-isolating. We currently have 6 active cases, and we've reported 225 cases since the pandemic began. It seems like it was just a very short time ago that we spoke about the end of the school year and the excitement and anticipation of the summer break for students, teachers, staff, and families. And I know personally, too, the time has gone by quickly, and we're now in the last week of August with back-to-school preparations underway in homes across the province. This summer was typical in PEI in that it has a way of passing way too quickly. As we reflect on the past 2 months, we are reminded of a number of significant developments over the summer. In late June in PEI, 24% of the eligible population was fully vaccinated, and this is now 77.5%. On June 28th, PEI had gone 26 days without a case of COVID. We have had 17 cases so far in the month of August. The Delta variant accounted for 1% of cases in June, and it now accounts for 70% of all new cases in Canada. And we've had 12 cases of the Delta variant in PEI. At the end of the school year, there were 95 active cases in Atlantic Canada, and currently there are 259 active cases in the region, with 201 new cases reported in the past week. In Canada, new cases were down 34% in June and are now up by 32% in the last week. And in the past week, cases were up in all but 2 provinces. Nationally, in June, the rate of new cases was consistent with what we would call a low incidence of disease, but now we are experiencing a moderate incidence with highest rates of new cases in the 20 to 39-year-old age group. In June, the Public Health Agency of Canada warned of a potential resurgence of the Delta variant in the fall and winter that we are really now experiencing earlier here in August, and it is earlier than expected. Canada is experiencing the 4th wave of COVID-19 driven by the Delta variant, with most cases, hospitalizations, and deaths occurring in unvaccinated people. Over 89% of new cases in Canada are in unvaccinated individuals, 5% in those who are vaccinated and not completely protected because they're not 2 weeks past their second dose, 5% in people who are partially vaccinated, and less than 1% in fully vaccinated individuals. The vaccine does not provide 100% protection, and there are breakthrough cases that occur. However, the data tells us that the COVID-19 vaccines are effective and are working to prevent widespread outbreaks and reduce hospitalizations. Although the summer has passed quickly, much has happened on the COVID-19 front. As I mentioned, the Delta variant has become the most dominant strain of COVID-19 in the country and is proving to be highly contagious with increased severity, and it may reduce the effectiveness of vaccines. COVID-19 is adept at seeking out populations with low vaccine coverage, presenting an ongoing risk for emergence of potential new variants. So we are at a critical point in our fight against COVID-19. As of Saturday, August 21st, a total of 236,434 doses of vaccine have been administered here in PEI. So 90.6% of the eligible population have received at least 1 dose of vaccine, and 77.5% of eligible island residents aged 12 and over have received 2 doses of vaccine. And PEI has one of the highest rates for first doses in the country. We know that 1 dose of vaccine provides some protection. However, 2 doses provides optimal and sustained protection at this point against COVID-19, including the variants of concern. All health PI clinics are now accepting walk-ins, meaning you do not need an appointment. And certainly check the website or call the booking line to confirm location and hours of operation before dropping in. Participating pharmacies across PI can provide first and second doses as well. Pharmacies are now able to offer Pfizer in addition to Moderna for individuals aged 18 and over. Please check the website for participating pharmacies and contact information. Even though we've reached a high rate of first doses in PI, there is still a large number of PI residents who are not fully vaccinated. Currently, over 50,000 PI residents have not been fully vaccinated, and this includes the 19,000 youth under age 12 who are not yet eligible for the vaccine. And we have over 31,000 adults who have not yet received 2 doses of vaccine. While we are proud of our high rate of first doses, we all need to do more to maximize the number of PI residents who are vaccinated. In the over 60 age group, the rate of full vaccination is well over 90%, but it is in the group that is between 12 and 39, for instance, only 62% of individuals are fully vaccinated. Now, I expect that number to increase in the next couple of weeks as more people get their second doses, but it is, there is a difference in those 2 age groups. So the rate of vaccine coverage in the under 40 group is still too low. We need individuals in this age group to step up and get immunized. If you have a loved one or a friend who's not yet been immunized, please talk to them about the importance of getting vaccinated against COVID-19. Encourage them to do it for themselves, for their family, for our children, and for the province. And if you are an employer, do whatever you can to help staff get vaccinated, and please reach out to our office for support if you have a number of staff who want to be vaccinated. The more people that are fully vaccinated, the less likely we will be exposed to COVID-19. There are a small number of PI residents who cannot be vaccinated for medical reasons, including allergic reactions, and we need to also be understanding of their situation. Our goal has not changed to protect all eligible island residents with 2 doses of vaccine as soon as possible. Since we talked about a target of 80% many months ago of having eligible island residents fully vaccinated, and when we set that, things have changed somewhat. National modeling suggests that this target needs to be higher across all age groups to protect our healthcare system and prevent the tightening of public health measures such as gathering sizes. We know that residents of long-term care and community care facilities are at high risk of serious outcomes related to COVID-19, and residents and staff of these facilities were prioritized in the first phase of the vaccine rollout that began in December of last year. Beginning a number of months ago, our office asked operators of long-term care and community care facilities to track and report on vaccine rates in residents and staff. And although the vaccine rate among residents in these facilities is high, there are some homes in which the staff vaccine rate is too low. And our office has been in communication with operators throughout the pandemic, and operators were previously notified that homes that do not reach 85% vaccine uptake among staff will be required to implement regular testing of unvaccinated or partially vaccinated staff. And we'll continue to have discussions, and we will be having discussions with long-term care and community care operators in the coming days about the next steps we will take to protect loved ones in long-term care and community care, including how we will work together to increase vaccine coverage among staff. And this is really another point around vaccine that I think is important to make. Until more people are fully immunized, island residents should wait 14 days after their second dose before traveling outside the province. And I recommend that anyone who travels to another jurisdiction, including Atlantic Canada, to wear a mask in indoor public places, to follow public health measures in that area, and upon returning home, if they develop any symptoms of COVID-19, please go get tested. When the Moving Forward plan was developed, it was anticipated that we would lift all public health and border measures by the middle of September. We now know the Delta variant has changed the landscape, and having 80% of people fully vaccinated is not enough protection, and we need to aim higher. The more people that are vaccinated, the more we'll all be protected. And then that lowers the risk of serious illness and hospitalization, and the less restrictive our public health measures need to be. We will maintain targeted border screening, testing, and self-isolation for unvaccinated individuals until the fall, until at least the middle of October, as an additional measure to support a safe return to school for our children. Our outbreak management will continue to include contact tracing, testing, and isolation for confirmed cases. Close contacts of positive cases who are not fully vaccinated will be required to self-isolate and test. Even though our population is highly vaccinated, testing will play an important role in our ongoing pandemic response. Access to testing and contact tracing capacity will remain a priority in the coming months. We will continue to focus on early detection, aiming to limit importation and working to contain the spread of COVID-19 when cases are identified. In particular, testing access is key for children who are not eligible to be immunized. We are in preliminary discussions with the federal government regarding a pilot project where easy-to-use self-test kits will be made available to some island children soon after the beginning of the school year, when we see the usual increase in mild respiratory illnesses in children. These tests will allow parents to conduct an at-home screening test for COVID-19 if their child is showing symptoms, and we'll have more information to share in the coming weeks. Some individuals who get infected with COVID-19 experience long-term symptoms, even after they recover from the initial infection, and this is called post-COVID condition or long COVID. Individuals with post-COVID condition are no longer infectious and have symptoms that are different than when they are acutely ill. To date, there are a huge range of symptoms associated with post-COVID condition, ranging from fatigue to shortness of breath to memory problems and difficulty concentrating. Very often, this condition interferes with the ability of the individual to carry out their everyday activities. Evidence is very early and emerging. However, the current data indicates that 80% of people with COVID-19 have at least one symptom of post-COVID condition for a number of weeks after their initial infection, and 60% have one or more symptoms that persist beyond 12 weeks. 10% of people with post-COVID condition are unable to return to work in the long term, meaning 4 months after their initial infection. And although post-COVID condition typically occurs in adults, emerging evidence shows that children are also susceptible to developing chronic symptoms after their initial infection. Given the range of symptoms, there's no one treatment for this condition. Treatment is individualized and focused on managing symptoms. Research is ongoing regarding the causes of post-COVID condition. We do know that the best way to prevent it is to take measures to prevent COVID-19 itself, and especially getting vaccinated. Since June, we've received just over 361,000 PEI pass applications. 47% of applications are from people traveling within Atlantic Canada, 29% from people traveling to PEI from outside Atlantic Canada, and 22% are from PEI residents. Our partners at Justice and Public Safety continue to receive and process approximately 4,500 PEI pass applications per day. And since June 27th, we've welcomed over 373,400 visitors to PEI. Individuals entering the province are screened when they enter PEI, and individuals arriving from outside Atlantic Canada are tested at the points of entry, along with unvaccinated individuals from within Atlantic Canada. The back-to-school public health guidance for the 2021-22 school year provides advice in key areas related to ongoing public health measures: vaccination, managing symptoms, hand hygiene, cleaning, ventilation, as well as enhanced measures, masking, cohorting, and physical distancing. To start the school year, our office recommends that masks be worn by staff, students, and visitors when transitioning through school buildings, and for all staff and students on school buses. In addition, masks are recommended for staff in classrooms in K-6 when physical distancing is not possible. We recognize that cohorting is more feasible in K-6 and in smaller schools. Cohorting is more difficult to implement in grades 7 to 12 due to the structure of course delivery. We recommended that schools consider alternatives to in-school gatherings, assemblies, and extracurricular activities in grades K to 6, given these children are not eligible to be vaccinated. Similar to last year, maintaining physical distancing is difficult to implement in schools while maintaining a full-time in-class learning model. We also recognize that especially in the lower grades, that physical distancing is very disruptive to social interaction that is central to childhood development. The guidance provided by our office to the education system recognizes the importance of minimizing community transmission to support in-class learning, which is vital to student learning and overall health well-being. It is my expectation that the education system will act accordingly based on the recommendation from our office, and that is similar to last year. We know the most important step we can take to allow our children to benefit from in-class learning is to continue to work hard to limit importation and spread of the virus. Ensuring PEI children, teachers, and staff return to school safely is extremely important to me as a mother and in my legislated role to protect the health of the residents of this beautiful province. It is my hope the upcoming school year will be as normal and safe as possible for students, teachers, staff, and families. Later this week, there will be a tabletop planning exercise with principals, administrators, and others throughout the education system to assist in preparing for potential outbreaks of COVID-19 in schools. The province released the back-to-school plan yesterday, and the Honourable Natalie Jameson and the Premier are both here, will join us to address questions you have regarding the reopening plan. And finally, I know I feel like this is going on for a bit, but slowly and surely, we will gradually adapt to living with COVID-19 as an endemic disease, one that is regularly found in our province. SARS-CoV-2, COVID-19, will be one of many respiratory viruses that still poses a risk and needs to be dealt with. But in the fall of 2021 and going forward, COVID-19 will still need to be managed in PEI. Since the pandemic began, we've learned much about how to protect ourselves and others from COVID-19 and other respiratory illnesses. Cleaning and sanitizing, physical distancing, hand washing, masking in public places, limiting close contacts, and staying home when sick have been core measures since the outset of the pandemic. And these measures will be part of our foreseeable future. It's important we find our own individual comfort level when we're going forward, making decisions on what personal health practices we will follow based on our vaccine status. Being fully vaccinated lowers our risk, but we look at the age and health of ourselves and those around us. The risk of severe illnesses from COVID-19 increases with age and health conditions. We look at the level of disease in the community. The more cases in the community, the higher risk of being exposed and infected. And the setting and activity, where we gather, with who, and what we are doing affects our risk. At the beginning, I reflected on some of the changes COVID-19 has presented to us in the last 2 months. And we would not have predicted in June that Canada would be in the fourth wave this early here in August. And we cannot predict with any certainty what COVID-19 will bring our way in the next 2 months. But we do know that vaccination will continue to play an important role in our fight against this virus. I urge all island residents who are eligible to be vaccinated to please do so as soon as possible. Being fully vaccinated will minimize the impact of a fourth wave in our province. As we look ahead to the fall, 18 months into this global pandemic, we have witnessed many beautiful acts of kindness and compassion. Unfortunately, there have also been some examples of behavior and language that can be described as inappropriate, bullying, demeaning, and they have been directed towards our team and our partners. And this is not acceptable. We are all tired of this pandemic, sometimes tired of one another, but we have gotten through this so far together, and we will get through this together. So as we continue our journey through COVID-19 together, more than ever, we need to continue to be patient and continue to be kind. So thank you. And I'll leave it there.
Well, thank you, Dr. Morrison. Just before we turn our news conference over to questions from our friends in the media, I would just say that to state the obvious again on behalf of all Islanders, just how impressive your leadership has been. It's been consistent, it's been compassionate, it's been at a level of kindness that I think that we've all been better for. And I'm sorry that parts of your job that you never had to deal with prior to COVID have exposed themselves to the extent that they have. But I hope that you know that you have my full confidence, respect, and through this, friendship. So with that, I will turn it over to questions from our friends in the media. And how do we do this? Do we do it in person first? What's the routine?
We'll go in person first.
Okay. Wayne Thibodeau, CBC.
Thank you very much. I think I'll start with Dr. Morrison. We heard today about UPEI's decision. I'm sorry, I'm actually going to pause for a second. I see tears in your eyes after Premier King's comment.
Yep.
Tell me a little bit about what's happening. It sounds like you are.
That's fine. And
I'm sorry. Yeah,
No, that's okay.
I'd like. I mean, you obviously have gone through a tough time over these past 18 months, and not all of what you're hearing is positive, is it?
Well, I mean, it has been a hard year for everybody, a year and a half for every single person in Prince Edward Island. And we've talked about it before. COVID touches everybody in whatever we're doing. And so I think it's been hard for everybody. And so I'm not immune to that. But it's impacted everybody.
But is it the public criticism? Is that what sort of hits at home?
Well, I also think we mentioned that people are tired, and I think sometimes your resilience isn't quite as good after a year and a half. But it's, when you go into medicine, you're trying to make the best decisions we can for the health of the population in this role. And we have a team that works so hard every day to try to protect Islanders and to make decisions that will keep us all safe. And sometimes we won't always make, in hindsight, it won't always have been the right decision, but we'll have made the best decision we can with the information we have for the right reason. And I think we need to be able to say that every night before we go to bed. And I know I have a team that does that.
Look, this has been a hard grind for every single Prince Edward Islander. As Dr. Morrison said, none of us are immune to it. That we have made a lot of very difficult decisions, and we live, thankfully, in a wonderful place where people are free to express their views and thoughts, and there's no shortage of courage for those to write or text or talk about what their views are. And throughout this whole exercise, if that's what you call it, from my perspective, there's only one thing that has pissed me off, sorry for the vernacular, but is that when our health professionals get attacked like they do, and look, attack me, call me what you want, that's the job I signed up for, it's not the job she signed up for. So I think it's important that Islanders know that every decision that I have made, if it falls to me, has come from her advice. I hear politicians questioning, saying we should do this or that, and I would just say to every Prince Edward Islander, if you were in this job, would you take the advice of a partisan politician or the chief public health officer who is a Rhodes Scholar, who is an infectious disease expert now? To me, that decision's easy, so I stand with Dr. Morrison.
If I could ask you. Do you need a moment?
No, I'm fine.
Okay. I wanted to ask you a bit about UPEI's decision today. They are going with mandatory vaccinations, yet we heard yesterday that our public schools branch is not going with mandatory vaccinations of its staff or its students. So I could see a lot of parents sitting at home seeing that contrast and saying, why is that the situation? I'd like to hear from the Chief Public Health Officer on your thoughts about those decisions.
Well, I mean, I think the whole topic of mandatory vaccination we're hearing it right across the country, and certainly a number of the post-secondary institutions, given the population that young people that are going to be at post-secondary, they're really, many of them have moved already in that direction. I think I think it's something we've talked about before in the sense that we want to make sure we encourage and do everything we can to maximize our vaccination rates, how important it is. We've talked about it today. But I think when you get into mandatory vaccination, it's something for the schools and for other areas to look at if they are not able to achieve the vaccination rates that are required and important for the setting that they're in. So that conversation is certainly will always be part of our discussion in various settings, but we're working on trying to get the highest rates in all the settings. And I think, and the minister can speak to this, but one of the things that I've certainly asked, and I know the minister has asked as well, is what is the rate of vaccination amongst teachers? Because I think you need to start with what is it currently. We have also agreed, and part of the information we have given the school system is that we will be providing aggregate data to each of the schools about what percentage of eligible students are vaccinated. So if there's a particular school that has 12 to 17-year-olds or 12 to 15-year-olds, we will be providing that to each individual school so we know what percentage are vaccinated. And it's important for us to know that for outbreak management, but also if the level of vaccination isn't at as high as it should be in a particular school, we can go do education. Can we provide more opportunities for vaccination at the end of school? What can we do to help support that? So that's part of that information and trying to do what we can to support vaccination in the schools.
And I know just my second question, and I think it falls on the same line, mandatory. You talked a bit today, which I thought was something new, about the number of staff in long-term care homes and the fact that you have some concerns about the numbers there. So given your rationale about you'd like to be able to reach these numbers of vaccinations without mandatory vaccinations, how do you handle that situation with seniors' homes with low numbers? Are you considering mandatory vaccinations? How do you do that?
Well, I think, I mean, I did speak to the Premier about my concerns this morning. We have already instituted a testing policy for those who are not vaccinated or are not fully vaccinated in long-term care and community care homes. But we have been in discussion with them, but I am concerned about the number of homes that do not have staff that are fully vaccinated, and that impacts their visitation restrictions that are in place, and I also think it's important for us to work very hard to get those numbers up because we want to protect those particularly vulnerable populations. So if there is an area like that, that would be an example where we may need to explore that. But in terms of mandatory vaccination, but we're watching, getting the information first.
And now we've got to go with someone else, but is that, are the staff or the long-term care homes telling you why staff are not getting vaccinated?
We've been trying to work with the homes, and some of it is just vaccine hesitancy, but and some of it is turnover of new staff. That's the other potential problem, and in terms of getting those rates up, but. We are running the numbers. They are supposed to report to us on a weekly basis, their vaccine staff numbers, and that's public and private. So they are supposed to be in today, and we're looking at them again today.
Thank you.
Thank you, Wayne. Stu?
Morning, everyone. I guess this is a question for Dr. Morrison, and it's pretty much going to be very similar to Wayne's question, but most of the parents I've been hearing from, the thing they seem to react the most to about the back-to-school plans is that there is not a vaccination mandate. And so I'd just like, for those parents who want to know why in this province we don't have a vaccination mandate, whereas in New Brunswick they do. I mean, you mentioned that it's difficult to find data about the teacher vaccination rate for staff. You know, you'll be providing data about the number of students, but what is the reason why, you know, within a population where, you know, a lot of people can't get the vaccinated under 12, that we don't have a vaccination mandate in schools?
And I think you're speaking about a vaccination mandate for staff.
For
just to-
staff, yes, exactly.
To be clear. So, I mean, we've talked about mandatory vaccination questions in this province for a long time, and we have some of the highest rates of school-based uptake in terms of students, probably in the country. We look at our rates every single year, and they are provided to the schools in terms of their meningitis vaccine uptake in schools, their tetanus and acellular pertussis vaccine uptake in schools, their HPV vaccine uptake in school, and we also know the rate of immunization before they enter school at age 5. So we have a really good sense of how well children are doing in terms of being protected, and students in our school system already. And one of the reasons we've not had to do mandatory is that the rates have been so high traditionally and this is a sort of broad part of the vaccination. In terms of staff, I think that's where it's going to be really important to know. I would anticipate that the vaccination rate of teachers and staff in the schools will be very high. And that will be confirmed, I think, through a process with the schools. And but if it's not the case, well, then maybe we'll need to look at working with the education system to mandate it. But at this point in time, I would anticipate that is very, very high.
Okay. And I guess if I could just ask about the elevated risk outlined in the back to school plan. I mean, I'd spoken to the Minister of Education yesterday about this, and there seemed to be some indication that occurs when there's a school outbreak of 2 or more cases. But is that the trigger for an elevated risk? You know, what point do we reach elevated risk?
No, I think, and that may have been. I think there's a difference between how you handle an outbreak and where. And what triggers that we would be looking at. And I think I heard actually the minister read them out this morning in terms of the measures, and I'm just looking so I don't want to forget any that are here. So because I sent them to the minister last night. So we would be looking at a number of indicators. So and that would be including the rates of vaccination among our eligible PEI population. As well as the students, the COVID-19 transmission in the community, the impact of a 4th wave on COVID-19 locally and nationally, and the impact of new variants of concern. So it wouldn't be based on that one case in a school or not, and so we basically are trying to go back to school as normal as possible. The difference is that we certainly, as we start the school year, the recommendation is for masks as we transition in common places and on buses. And then if we need to make a change to a higher risk category, we'll do so. And as you know, Stu, if we need to, we act quickly, and we have acted quickly for 18 months when we need to, so we'll continue to do that.
And if I could just add, Stu, to that, I mean, I think that the back-to-school plan in PEI is vastly different than the back-to-school plan in Ontario for a number of reasons. Number one is we haven't really been out of school. We've missed 2 days of school last year. We have been in school. We've been through this. And we have a good track record of getting to now. We have an increased number of vaccinated islanders in place, which gives us a little bit more level of comfort. And as Dr. Morrison has suggested again, is that we still are maintaining our border measures and our testing and our components at our points of entry, because the importation of COVID remains a concern. So because we're able to maintain that level of containment at our borders, it gives us that comfort to move ahead in this regard. But if we've learned anything in 18 months about COVID, that it can be unpredictable, and our plan is built to react if we need to react, and it will. But I think it's important to remind Islanders that back to school for us this year is almost back to school in most other normal areas, and that is get your scribblers and pencils, et cetera, and, because we have been in school, and that's largely because of the measures Dr. Morrison has put in place the last 18 months, so.
Last thing for me. There is a reference, I guess, to ventilation. Improvements to ventilation should occur for schools, I believe, that are not up to a standard. Which schools would not be up to a standard, and what is that standard from the CP? Is it a CPHO standard, or is it simply another department that is setting that?
Maybe I'll start. I mean, the standards that are those referenced by school occupational health that are usually called the ASHRAE standards. But in terms of the school's ventilation, I'll let Minister Jameson speak to that.
Yeah, certainly. Thanks for the question, and Stu. And certainly good ventilation. It can be natural ventilation or mechanical ventilation. And as Dr. Morrison had indicated, so all schools adhere to the provincial occupational health and safety regulations. They are continuously monitoring their ventilation systems daily. And certainly if there's any concerns, they're addressed immediately.
Yes, please.
Yeah. Thanks for the good question in English. It's pretty much the same, but in French.
Okay.
Dr. Morrison, bonjour.
Ça va?
Dr. Morrison, je voudrais savoir, un peu comme Stu vient de demander, pourquoi avez-vous tout d'abord décidé j'ai perdu le mot en français, ease the restriction, d'alléger les restrictions à l'école, plus de cohortes, plus de masques obligatoires. Pourquoi avez-vous décidé d'aller de l'avant dès la rentrée scolaire? Pas d'obligation dans les masques et les cohortes.
Alors, et puis, j'essaie de faire ça en anglais aussi, mais c'est vraiment, on commence l'année, même sorte de niveau de mesures en grande place, comme on a fini l'année. On dit qu'il faut avoir les masques pour commencer l'année. On va voir si on a besoin de les garder. C'est les masques quand vous marchez dans les corridors, quand vous entrez à l'école et sur les autobus. Alors, c'est pas vraiment qu'on change, c'est une recommandation que j'ai l'expectation que le système scolaire va mettre en place. Et puis après ça, on va voir ce qui arrive avec le Delta et puis la quatrième vague. Et on va faire les changements si on a si c'est plus grand risque ou non. On sait que c'est tellement important que les enfants sont à l'école, ils sont ensemble. Et puis maintenant, on sache que c'est plus difficile pour comme les 7e à 12e années de faire les cohortes. Parce qu'on en a appris des choses de l'année passée, mais on veut qu'ils soient vaccinés le plus grand nombre que possible. Et puis, on va regarder régulièrement le nombre de personnes qui peuvent être vaccinées par l'école. Et puis, à un moment donné, j'espère qu'on va entendre quand on peut vacciner les plus jeunes. Mais on sait toujours qu'est-ce qui arrive hors l'école influence qu'est-ce qui arrive à l'école. Alors, c'est important qu'on travaille tous ensemble, qu'on a fait depuis 18 mois hors de l'école et puis pour qu'on protège les étudiants et puis les personnes qui travaillent à l'école.
Pour parler de vaccination, je sais que ça a été compliqué pour vous depuis 24 heures par rapport à cette vaccination parce que beaucoup de parents la réclament, demandent l'obligation de la vaccination dans les écoles. On sait qu'au Nouveau-Brunswick, en Nouvelle-Écosse, on est plutôt vers la vaccination obligatoire. Même question que Stu, finalement, c'est quoi le facteur qui vous pousse à persévérer? Non, la vaccination ne sera pas obligatoire pour le personnel dans les écoles de l'île du Prince-Édouard.
Je vais être claire que je ne vais pas persévérer si on n'a pas le nombre de personnes qui travaillent là ne sont pas vaccinées. Alors, on va voir le nombre de personnes, les enseignants, j'imagine qu'ils sont un très haut, grand nombre sont vaccinés. S'ils ne sont pas, on va avoir la discussion. Et on va avoir la discussion assez vite pour faire obligatoire, mais il faut commencer pour avoir l'information pour le nombre de personnes qui sont vaccinées. Alors, c'est pas que on va pas discuter, mais à ce moment, on a un grand nombre de personnes qui sont vaccinées et on va continuer à faire ça.
Je m'excuse de rebondir, mais en gros, est-ce que ça veut dire que si un professeur n'est pas vacciné, vous allez lui demander de rester à la maison, de ne pas aller travailler?
Ça, c'est une question vraiment pour les ministères. Mais à ce moment, on veut voir le nombre de personnes les enseignants qui sont vaccinés. Et puis, mais au but, on veut protéger toutes les personnes qui travaillent ou qui sont étudiants à l'école. Et je sais que c'est la même chose pour le ministère et qu'on veut prendre soin de tout le monde qui travaille là. Mais et si on doit faire obligatoire, on va le faire un jour, mais pas aujourd'hui.
Merci.
Okay, do we have some questions from our online participants?
Louise Martin, CBC. Hello, nice to see all three of you, and thanks for your time and taking our questions today. Sorry I'm not in the building, but I'm sorry to hear about some of the bullying behavior, Dr. Morrison and Premier. I wanted to ask about the education plan again. I know you've been talking about it a lot, but an epidemiologist yesterday did tell us that he thought PEI's plan puts confidence over caution. And the education minister herself this morning speaking about her concerns with my colleague Mitch Cormier on Island Morning having kids under the age of 12 of her own. So I'm just wondering why not implement a different plan, say with mandatory staff masking, cohorts, distancing for K to 6, given the higher risk and the fact that those children cannot yet be vaccinated.
Do you want to go?
Who wants to?
Hi, Louise. I think we tried to address that in various points that I spoke to in my remarks, and I think the comments from one of your previous interviews. I think sometimes. For someone who's not been involved in the process here in PEI, we have a slightly different, we have something fairly unique here in terms of our testing and our border measures and our isolation plans that are in place. And I think there was perhaps, it was not clear that the recommendation, I made a recommendation last year for masks in school, and that was implemented in policy in the school. It was not a mandate that I put in place. And I made a recommendation that I anticipate the school system will put in place. So I think somehow that, wasn't as clear perhaps when it was released. And so I think we have... we know that, and we've talked about that in that recommendation, which I know will be implemented, and I anticipate will be implemented by the school system for masking for staff. In that K to 6. There's a lot of natural cohorting already in those lower age levels. We have spoken with Norbert Carpenter and Gilles about trying to maintain some degree of cohorting even as we go. We mentioned trying to avoid big assemblies. So those in those younger age groups. So Louise, I think that there is concern, and I heard the minister this morning say she's been worried every day for 18 months, and I certainly can echo some of those feelings. Worried about the whole province, and worried how we can keep us all safe. And so I think this is a plan that actually looks quite similar to many plans across the country. I know Nova Scotia and New Brunswick, BC, have all come out with plans in the last couple of days. So we're taking a plan out at a similar time in a slightly different situation in that we had in-class learning full-time almost completely all year. And we will make adjustments. And that's why we have different scenarios in terms of lower risk and higher risk. And on top of that, we're starting the year with a recommendation for masks to be worn on buses and while you're transitioning in schools, and for staff in those lower grade levels. So I think we will likely end up having to adjust at some point in time, but I really hope that for making sure school goes well is important for the education system, but it has huge impacts on all sectors of our province, and so we all want it to go well.
And Louise, I just add to that we do have confidence in the plan we released, which is why we released it, but it's also steeped in caution as well, and that's what we've been trying to do for 18 months. This is a volatile pandemic. It's been up and down. There's been lots of people in other places who have been trying to think they've been through this, and that isn't the approach that we have taken. We have taken the best information that we have, knowing what the parameters are in the province, in the region, and across the country. But we are confident in the plan, but we have lived through 18 months of having to adjust and adapt, as factors rear their heads, and it will be the same for this here. But, I'd say to that epidemiologist, we are confident in our plan, but it's also steeped in caution.
To be fair, he did say 100% how well PEI has done. He was just sort of saying now that Delta's there and seeing what's happening in schools in the United States and elsewhere,
Absolutely.
It's a big concern for him. Now, the other question I have is about the passport situation. So probably Premier King and Dr. Morrison, both of you on this one, as more and more provinces we're hearing are implementing some sort of a passport system. You have to be vaccinated to be able to go to an event. We're hearing more and more sports teams implementing mandatory vaccinations for people attending and working at different venues. Is PEI going to implement something like that? I think there was talk at one point of that being a national program. It would seem to make more sense as people are traveling between provinces. Sure. What would Islanders need, say, to go to BC where it's now a requirement to show proof of vaccination?
Hi, Louise. Maybe I'll start and then the Premier can add. I think the vaccine passports, and I think there's sometimes different words being used, but a record of vaccine, there's discussion that has been underway for a number of months with regards to a national vaccine record or vaccine passport for international travel. And that is a little bit different than your question, but I think it's important to identify that we are participating in that discussion, and I know ITSS and various sectors are involved with that, and that is an important discussion at the federal level, and the Premier may want to add to that. And in some ways, we have, with our PEI Pass, it is really trying to facilitate a record of vaccine, showing a record of vaccine at our borders, which we've now had in place for a number of couple months, so we've been doing that, and certainly we've never called it a vaccine passport, but it is certainly an indication of your vaccine record, and that is to help facilitate your identification if you've been fully vaccinated at the point of entry. I know in terms of having vaccine records to show at various locations, that has been, we're watching that with interest. It's happening in England, it's happening in Israel, it's happening various parts, and starting to see it happening in various parts of this country. And so we have not, I think, certainly had any real decision or conversation on that. At this point, we are focused on making sure we get as many eligible Islanders fully vaccinated as possible, and I think that's where our effort is. But certainly aware that those things are happening, and what that could look like in PEI.
Yeah, and I'd only add to that, Louise, that I think that this is where the world is kind of going. And if you needed a reason to get a vaccine other than the general overall health and safety of you and the people you love and the people in your community, if that isn't enough, which I think it should be, I think you're seeing across the country where you need to be a proof of vaccine to get into, like, Maple Leaf hockey games in Toronto, for example. I wouldn't be surprised if you see something similar for some of the bigger events in PEI, which are privately owned, for example. And I think that is kind of where the world is going. I look forward to a discussion with premiers and the Prime Minister after the election, whoever the Prime Minister is, about how we can have some consistency around that province to province. But I think the reality is that this is where the world is going, and maybe not for a short time. So I think this needs to be something that everybody who is hesitant for one reason or the other to get a vaccine, I think your everyday life is going to be impacted if you don't have one. And we'll have a broader discussion in the weeks ahead for sure. But I think you'll probably see something along the lines across the country here in the next number of months. Yeah.
Say it could actually prompt the unvaccinated that you speak about, the number's still too low of people under 40 to actually get vaccinated if they can't, say go to a movie without it.
Exactly. I think that to me is it should help those who want to choose to get vaccinated for sure. And I just think, for example, like when I talk about the Maple Leafs or the Raptors or the Blue Jays, they're requiring a proof of vaccine or a testing component for somebody to get in. I think a lot of these private enterprises don't want to see any unnecessary impact to their already impacted operations. And I think you're going to see some, groups and take that on here as well. Whether or not that will be mandated provincially, I think will need to be greater discussion with Dr. Morrison and her staff, but also with other officials across the country. But as I say, I think that's where the world is heading.
Thank you very much. Thank you.
Thank you.
Gabrielle Drummond, Radio-Canada.
Good afternoon to you all. Ma question, c'est en français. Tout d'abord, pour la ministre Nathalie Jamieson. Alors, dans le plan pour la rentrée scolaire, la plupart des consignes sont des recommandations. Alors, je veux savoir comment le ministère va faire le suivi auprès des écoles pour assurer que les élèves vont rester en sécurité et aussi pour assurer que les systèmes de ventilation fonctionnent bien et qu'on va aussi minimiser les risques de propagation de la COVID-19.
Merci pour la question. Je vais répondre en anglais parce que je dois encore pratiquer en français pour les interviews. Mais in terms of the ventilation, as I had suggested or had indicated to Stu, certainly we encourage good ventilation along with all other health measures, and we are working alongside the public schools branch as well as the Department of Transportation and Infrastructure to apply for the federal dollars that had recently been announced to upgrade some of our ventilation systems. So I'll be certainly looking forward to providing more details around that in the months ahead. With regards to the plan, most certainly I have such a strong faith and trust in the guidance of Dr. Morrison and our Chief Public Health Office. She's gotten us to this point with regards to all of our measures, and in discussions with her in the weeks leading up to the release of this plan, again, the utmost confidence in the guidance that she's provided, and certainly with regards to the recommendations, we'll be working with all of the schools, all the administrators, all the staff to operationalize the plan. I know that Dr. Morrison had recently indicated that she'll also be having a tabletop discussion with the principals, vice principals, and administrators to help support them here in the weeks to come. But as we've proven throughout COVID, throughout the last 18 months, we are ready and willing to adapt quickly if necessary, and ultimately the safety and health of our students and staff and all Islanders has been continuously of utmost importance. And certainly I just want to take this opportunity with all the tears that were shed earlier. I do want to thank you as well, Dr. Morrison, for your leadership, and Premier. I said it with Mitch Cormier over the radio this morning that I too have had a lot of sleepless nights. It hasn't been easy on my family, and certainly I just can't tell you enough how much I appreciate you both. So thank you.
OK. Thank you very much. Merci beaucoup. Ma prochaine question, c'est pour la docteure Ed Morrison. Docteur Morrison, c'est un sujet qui est quand même très important parce que la Nouvelle-Écosse va imposer bientôt des restrictions aux voyageurs provenant du Nouveau-Brunswick. Est-ce que l'île prévoit aussi d'imposer des mesures, particulièrement des mesures sanitaires, particulièrement aux voyageurs du Nouveau-Brunswick pour l'instant?
Bonjour. Vraiment, on vient d'en faire depuis le fin de juin. À ce moment, les voyageurs de Nouveau-Brunswick ou les insulaires qui voyagent à Nouveau-Brunswick et retournent ici, ils doivent isoler pendant 8 jours, avoir 2 tests. Alors, on a vraiment pris un pas que Nouvelle-Écosse vient de faire. Et puis, mais on s'inquiète un peu à cause des nombres de cas qui augmentent et puis qui sont en plus grand nombre partout au Nouveau-Brunswick. Alors, c'est pour cette raison que j'ai indiqué qu'il faut, pour les insulaires qui voyagent à Nouveau-Brunswick, j'aimerais qu'ils soient vaccinés 2 fois et puis avoir 2 semaines après, avant de voyager. Quand ils sont là, mettre leur masque, suivre les mesures de santé publique. Et puis, et finalement, quand ils retournent à l'île du Prince-Édouard, même la première indication qu'ils ont des symptômes va être testé. Et puis, si vous avez un choix pour faire le back-to-school shopping ici, c'est peut-être mieux d'en faire ici.
C'est très bien. Merci beaucoup.
OK. Merci.
Well, I believe that ends the online. Do you guys have more here, or Wayne? Sure.
If I could, I don't know if it's going to the Premier.
You're breaking all protocol, but
I
go
know.
ahead. That's fine. Yes.
This will be my last invite in person. We've seen Nova Scotia take steps with regards to Moncton and the cluster there. I am curious if PEI is looking at doing something different. I know we are obviously have certain protocols at the bridge, but if you're from Atlantic Canada, you're not rapid tested. So how are we handling, or what are we looking at in terms of what's happening in Moncton?
Well, I think that was a very similar question. I just tried to answer in French, so thank you for asking again in English. What Nova Scotia implemented or announced yesterday is really something in part that we've been doing since June, where we have anyone who travels to PEI who is not fully vaccinated has to be tested and isolate for 8 days and get tested again. Islanders who travel to New Brunswick and come back who are not vaccinated also have to isolate. And so we are watching. So we've done part of what Nova Scotia has already implemented, but it does certainly, as we see the numbers increase in New Brunswick and spread even outside one region, it does raise some concern, and that's why that really those, pieces of advice I'm trying to give Islanders: be fully vaccinated plus 2 weeks before you go to New Brunswick. And when you're there, wear a mask, follow public health measures, physical distancing, et cetera. And when you come back, whether you're vaccinated or not, if you have any symptoms, go get tested. And I said in French too, and as we approach the last week or so, if you have a choice to do back to school shopping, maybe stay local.
I would be remiss if I didn't take the opportunity for the shameless plug to encourage all Islanders to shop on PEI for back to school. If it's been your thought before that you need to go elsewhere, you should erase that from your memory. We have great selection here. We have great merchants, great stores who would only be too happy to make sure you have everything you need to get back to school here safely. So thank you, Wayne. Thank you, Stu. Thank you, everyone. It's good to see the media who are here in person. Thanks to those who are online. You guys have a tough job as well, but really appreciate the way you go about your work and informing Islanders. So thank you very much, and thank you, Minister, and thank you, Dr. Morrison.